Diabetes is known to damage the patient's eyes. The four areas where the diabetes will affect are: number one, early onset of cataract. So diabetics get cataracts much earlier. Second, there are changes due to the changes in the blood supply and the blood vessels where the patient may get a diabetic retinopathy. The third, there are changes of swelling in the seeing part of the eye called the macula, which is the central part of the retina, which may undergo swelling changes caused diabetic macular edema. And the fourth, there is much higher chance of the diabetics getting glaucoma, which can devastate the quality of vision. Initially, there are no signs and symptoms of diabetic changes in the eye. It is to be known that a frequent eye examination in any person with even a pre-diabetes stage, where the blood sugars may not be that high, is mandatory and essential. It is for the doctors to figure out whether the early changes have started. In the later advanced stages, there could be blurring of vision, there could be central loss of vision. That is, that you start seeing black spots and black areas, which could be due to the macular edema or due to some changes of hemorrhages which is there on the retina. There could be flashes of light, there could be sort of restriction in what you see as a tunnel vision, which can happen in glaucoma. So any of these conditions, they are seen at a much later stage of the diabetic retinopathy changes. So remember, diabetes is a preventive condition of the eye where if there is involvement, it is very essential for you to be checked at a frequent stage earlier. Diabetes is very prone to have permanent eye damage, and the vision can be affected with either changes of the macula or in the retina or due to glaucoma. The changes due to cataract are easily reversible, but any changes in either the retina or the optic nerve or glaucoma, which also affects the optic nerve, they will not be reversed. Treatment and management of diabetes is preventive by and large. If you have a cataract, that can be operated. If you have changes of diabetic retinopathy, they are managed with either laser, which is preventive to burn those areas which are hypoxic, which means there's less amount of oxygen availability. If there is an extensive damage, then we have conditions where there is bleeding into the eye. In these conditions, a vitrectomy, which is a very major surgery, can be conducted to take away the hemorrhage out of the eyes. Then there are conditions where there are macular edema, swelling in the macula. These could be reversed by giving the anti-VEGF injections, which are known to partially or temporarily relieve the swelling. So there are people who get relief with the injections, but by and large, this is a short-lived advantage, because every 6 to 8 weeks you will have to probably visit the eye doctors. If there is a glaucoma-induced damage, that is preventable, that cannot be cured. So any damage due to glaucoma is irreversible. Best tip which can be given to a diabetic is to keep the eyes being checked regularly by your ophthalmologist. A general doctor will not be able to see this. You have to visit your ophthalmologist to ensure that the retina is checked, the glaucoma is evaluated, and of course if there's early cataract, that can also be managed very, very easily. So the key message here is, please keep visiting your ophthalmologist at least once a year if you're a diabetic, or every 6 months if there are changes already in the eye, and if there are advanced changes, you may need to visit your ophthalmologist as early as every 1 month or every 6 weeks.